Hi, everyone. We are so excited for everyone that came tonight. We are looking forward to going over this content of discussing BPH, its symptoms, and treatment options out there. We have Dr. Conaway tonight, and he is our prostate specialist who specializes in minimally invasive treatment of the prostate. So, what we are going to do is turn the time over to him. He's going to run through just the variety of treatment options. And then at the end, if you have any questions, please submit them in the chat box or in the Q&A box, and we'll have some time at the end for any questions you might have. So I'll go ahead and share my screen, and we'll turn it over to you, Dr. Conway.
Thank you, Maya. Thanks for being our moderator and keeping me organized and on the right slide. And thanks everyone who's joining this live event tonight. I really appreciate your time. We know your time's important, so thank you for being here, and we'll try to be respectful for your time, and I'll try to be direct and efficient with the time. Tonight is really about education. Many men assume medications or surgeries are the only options for enlarged prostate symptoms, and that's simply not true anymore. So my goal tonight is to help people understand what enlarged prostate symptoms really look like, how we think about them, how we evaluate them, and what treatment options exist, including minimally invasive options like prostate artery embolization or PAE. Most importantly, not every urinary symptom is automatically caused by the prostate. So, I think I had a career before medical school, and I gave presentations to mostly Fortune 500 companies. That was a very different audience. And then I spent most of the last 35 years doing presentations for healthcare professionals. Now we're doing public presentations. I think this is our third one of this webinar series. And although audiences are different, there is one commonality that goes through any presentation, and that is you tell people what you're going to tell them, which is what I just did, and then you tell them, and then you tell them what you told them. So hopefully I'll do a good job of that tonight. And so let's start out about getting right into it. What's the prostate? Well, it's an organ that sits just below the bladder. It surrounds the urinary channel, and as it enlarges in men's lives, then it will squeeze the urinary channel, causing obstruction and symptoms that are similar to stepping on a garden hose. So that's what causes the classic urinary symptoms that men notice. And so, next slide. So this enlargement, what we're going to call benign prostatic hyperplasia or hypertrophy, is the enlargement of the prostate, and it's incredibly common, as you can see here. So by 60 years old, half of men have some evidence of the enlargement of the prostate, and by 80, it's affecting the majority of men. Now, that doesn't mean that they all have the same symptoms or the symptoms are as severe in every person. Of course not. Every individual is different, but it is important to understand that there are symptoms from this. And probably really importantly, what we see all the time is that men often wait years before seeking help. So we don't want men to just assume these symptoms are just something they have to live with. There are excellent treatment options available today, like prostate artery embolization, and we'll get into all of that. So let's move forward to the next slide. So these are the symptoms that you might be experiencing, and the top line is really the classic ones of obstruction. That's going to be a weak stream, difficulty emptying, straining, feeling like that urine is still left behind in the bladder. Those are the classic ones. But other symptoms that can be from prostate enlargement are this lower slide here. And in medical terms, we're going to call these things urinary urgency, urinary frequency, and nocturia. And they can be related to prostate enlargement, but they can also come from bladder conditions. So not every urinary symptom is automatically related to prostate enlargement and doesn't automatically make you a good candidate for PAE. That's why proper evaluation is important. So let's talk about how we start to think about and working through these things. Next slide, please. Yeah, so most men don't even realize that they're already experiencing these symptoms and mitigating them on their own. Often men are already doing things like limiting fluids before bedtime, avoiding caffeine and alcohol, and other kinds of lifestyle changes that can be helpful in mitigating your symptoms from an enlarged prostate. Um, Once the symptoms get bad enough and the prostate continues to enlarge, then we often are going to medications to try to be helpful. They relax the bladder and try to stop it from enlarging. And those medications can be quite effective. They can also have side effects like dizziness, fatigue, sexual side effects, or over time they can just simply stop working well. Um, Historically, interventions like surgery often are the next step. And so surgical procedures can be very effective, but many men are looking for less invasive options that aren't necessarily performed through the urinary channel. And that's why most of you are tuning in tonight. So, how do we start to think about your treatment options? Well, we want to understand how severe your symptoms are. So, that's what this chart is starting to give you an idea about how we look at symptom severity, quality of life, and prostate size as we begin to work you up and figure out what's going on here. So next slide. As your symptoms worsen, then as I indicated, surgery or some kind of intervention is going to be the next step to help control your symptoms. And this is a way that we start to think about um, individualizing your treatment, because that's where we are in modern medicine. It's not a one size fit all. We want to individualize it to the person. And one of the key components here that you can see is that each column represents the prostate size, and treatments are going to be more effective depending on what size your prostate is. And of course, they can have different side effect profiles, but the most important part is getting properly evaluated so that we can get the right treatment to the right patient. So let's get into actually prostate artery embolization. So next slide. So prostate artery embolization is a minimally invasive outpatient procedure. You come in that day, you get an IV to get the sedation. It's done through a pinpoint access, usually in the groin, sometimes in the wrist. And we'll, through that access site, take a small tube, what we call a catheter, and introduce it into the artery that goes into the prostate. And we'll start to reduce the blood flow to the prostate. And there's an artery on each side, and so we'll go into both of those to do that. And as that blood flow is decreased, the prostate will shrink over time, and that will allow the relaxation of the prostate on the urinary channel and improving your symptoms. Um, During the treatment, you will go into the room, we'll do that. You come back out into the recovery area, you recover quite quickly off the medications. We take out your IV, you go home that day almost always. You don't need a urinary catheter in the bladder, almost never. And then we'll give you some medications to deal with any kind of discomfort that may occur in the immediate aftermath. But people recover quite quickly. And that's why it's such an interesting option for so many men. As you see on the bottom of this slide, it is endorsed by the American Urological Association. And in fact, just this month, they raised the level of evidence that supports this treatment option to the second highest available. And so it is a well recognized and very effective treatment option. Next slide. So, who's a good candidate? Yeah, so we're really looking for men that have urinary symptoms by an enlarged prostate. They want to avoid traditional surgery and they have not responded well to medications or conservative treatment. Um, there may be additional workup that we need to do to see if you're not a good candidate, as some of these things indicate. And we'll work through that to make sure that um, that you are a good candidate for the procedure, or get you directed towards the proper option for you. So, what I wanted to say, kind of in closing, is if these symptoms sound familiar, that you're struggling with a weak urinary stream, straining to urinate, um, that you feel like you haven't completely emptied your bladder, then those are good signs that you've got prostate enlargement. Maybe medications aren't working for you anymore. And so we want to encourage you to come in and get worked up and find that treatment option that's going to be the best for you. So we would be happy to help answer any questions that you have about PAE. And many men assume that surgery is their only option for prostate artery enlargement, and that's just simply not true anymore. So we would like to welcome any questions at this time.
All right. Looking at the chat, the first question for you, Dr. Conaway, is will the prostate shrink on its own or with supplements?
So there is something that can occur where the prostate can slowly shrink. There is a medication that is recognized by the FDA. There's actually two that are pretty well known, and those can be prescribed, and they can be effective in helping mitigate symptoms. And they have shown some evidence of mild shrinkage in the prostate. So, can supplements do it? Well, supplements are not as well regulated, and so our evidence for showing that is pretty minimal, and that's not considered a recognized treatment option. I'm not saying that supplements can't, but because of the scientific evidence behind that is just not very well documented. Now, there is two medications that have been shown to show some mild shrinkage of the prostate. Very good question.
Yeah, and we have one somewhat related. What are the drawbacks to taking medication long term for BPH?
So, you know, medications are more likely to simply stop working. They can have side effects, and of course, they can interact with other medications. So each situation can be quite individualized, and it's hard to generalize something like that. But in general, medications aren't necessarily thought to be harmful over time, is in that it builds up a negative effect for patients. Any other questions?
A few more. Does PAE need to be performed again in the future?
Yeah, so that's a great question. So the prostate is still being stimulated, and it will grow just like it grew before anybody got medications or treatment. And so with all treatment options that are interventions, and this really can be true on a wide scale, is that the prostate will continue to be stimulated and grow in general. And so although with any option, it's possible that the prostate grows back so that symptoms come back again. Now, some have more durability than others. Prostate artery embolization actually is shown to be the less durable of all of these. It's easiest to get through. It has the least amount of complications and side effects from the treatment itself, but it also is the least durable. The gold standard is TERP, and it is the most durable, and it's also got the most complications and side effects from the treatment too. So there is a trade-off, but even it shows that it has to be repeated in time in some people.
Next question, how do I know if I have nocturia?
Nocturia, yeah. Usually, and some people will use this differently, but if you're getting up more than one time at night to empty your bladder, that's waking you up to empty your bladder, not because you're waking up because you don't sleep well, but your bladder is actually full and you have to get up and empty it more than once a night, then we consider you have nocturia. And there can be some pieces that go into that we need to look into as to what are you on medications that or other things that might be causing that? Your intake, all kinds of things can go into it. But in general, nocturia, more than one time of emptying your bladder at night. Other questions?
We have one. Does a urologist perform the PAE procedure?
I am not aware of any urologist performing this. Now, I am aware of all kinds of urologists hiring physicians trained like me to perform it. But in general, not many physicians that don't have a pretty extensive background in doing these kinds of minimally invasive procedures want to take on something that's a little bit technically challenging and might be considered kind of out of their lane and their treatment because it's performed by an individual with their skill set. So they may feel like that's a little bit of a challenge for them. So I don't know of any urologists that are performing it.
Okay. Dr. Conaway, would you mind just going through the process of what it would look like when somebody comes to Clarity Care? Let's say they have a consultation with you and then go through the procedure, just what the whole system would look like.
Sure. Before you even arrive, we're already interacting with you, finding out medical history, finding out any kind of workup that you've already had, and all of that kind of thing, so that when you arrive, we can try to have as much information as possible to kind of go over with you and give you as quick of an assessment as we can. But we'll be clarifying things. So you'll meet with myself or one of my partners that performs the procedure. Will evaluate your situation and individually look at what's going on with your situation. We often will get additional workup, but sometimes people come with everything that we need to give them an assessment and tell them what their options are and what we recommend. That might include additional testing, and it might include getting more information that we were not aware of until you showed up. But most of the time, we've gotten everything that we need to assess your situation, and we can kind of go over that, what it looks like, and whether prostate artery embolization might be appropriate for you as an option.
Excellent. I think one thing a lot of people would want to hear is just what others have said about the procedure after they've gone through it, what their experience has been, what the people are saying.
Sure. Yeah. What I'll tell you, and we do have some testimonials that you can look at, but most of our patients, they are really thrilled about their ability to go back to work so quickly. Their low impact on their life. It's just such an easy procedure to go through and very simple for them to kind of understand and get walk through the situation of what's going to happen to them. They come in, they experience the procedure, and then any discomfort from the procedure is gone quite quickly. what I think that many of our patients will say is that although some of them will report that they had great success in their symptoms improving really, really fast. And when I say fast, meaning like within 1 to 4 weeks, that can certainly be true. We often tell our patients that because the prostate shrinks over time from the reduced blood flow, that's what really improves your symptoms. And that can take a while because the prostate will continue to shrink for up to 2 years. And so it's that shrinkage that makes the difference in improving their symptoms. So we tell them, that their symptoms can continue to be improving from 3 months to 12 months. And that's very common for us to see. And so that is what I think most of our patients would tell you as well.
Awesome. Well, that wraps it up from the audience questions. Thank you so much to everybody who attended. We're so grateful for Dr. Conaway and walking through all the treatment options, especially prostate artery embolization. Of course, if you'd like to learn more, feel free to scan the QR code. You can learn more on Clarity Care's website about BPH treatment and contact our team. But we hope everyone has a great night, and thank you so much.
Thank you very much. Thanks for joining us, and I hope everyone has a good night.
Bye, everyone.